So good morning, good afternoon, and good evening, everyone. Thank you for joining us for our October of 2022 Global One Health Initiative webinar supported by the NIH Fogarty International Center. Today, we will be hearing from current and former students and fellows having worked with the Ohio State University Global One Health Initiative and continuing to do One Health work in their professional careers as part of our Building the Next Generation of One Health Practitioners, current and former students, fellows panel discussion. Our panelists today include Dr. Pallavi Oruganti, a veterinary medical officer in epidemiology with the United States Department of Agriculture, Animal and Plant Health Inspection Service, or APHIS. Melanie Lopez, who will be joining us shortly, a senior program manager with the Boston Public Health Commission. Dr. Mostafa Ghanem, an assistant professor at the Virginia Maryland College of Veterinary Medicine, and Dr. Joseph Nguta, a senior lecturer at the University of Nairobi. And our moderator for today will be our Global One Health Initiative Director of Outreach and Engagement, Dr. Amanda Berrien. And Dr. Berrien will ask the panelists a series of questions. And once all questions have been answered, we will open up questioning to the audience and ask that you please enter your questions via the Q&A feature. And with that, I will go ahead and hand it over to you, Dr. Berrien.
Thank you so much, Dr. Binkley, for the nice introduction, and welcome all panelists for joining us and giving some of your time today to this GOHi webinar. And thank you to the attendees for tuning in. I think we'll have an interesting discussion hearing from our fellows and former students who all had some interaction and engagement with the GOHi while they were doing their training. So to kick us off, I think we'll start with just an easy question of hearing more from each of our panelists and hearing basically them introduce themselves and provide a little bit of detail about their background, what degrees they have and where they obtained those degrees, previous work experience that they have, and their current role that they are in today in just a couple of minutes. And maybe we'll start the top of the list here with Dr. Oruganti.
Hi, everybody. So my name is Pallavi Oruganti. So a little background about me. I started at the Ohio State University for my bachelor's in anthropology. And after that, I moved on to do the Master of Public Health, Veterinary Public Health program, as many of the other panelists have done here. And then I continued on in the veterinary program. And throughout that time, my focus was on public health, global health, and kind of leaning towards large animal medicine as well towards the end. My research experiences throughout that time all focused on applying social science methods and anthropological methods to questions of One Health and zoonotic disease. So after veterinary school, I accepted a position with the U.S. Department of Agriculture, and now I'm currently a field veterinarian in Colorado.
Excellent. Thank you so much. And we will hear more about some of that research in a future question. Ms. Lopez, would you want to go next with your introduction?
Yes, absolutely. Good morning, everyone. My name is Melanie Lopez, she, her pronouns. I have a bachelor's in pre-veterinary medicine and animal biosciences with a specialization in wildlife conservation from the University of Delaware. From then, I went on to the Ohio State University to gain my master's in veterinary public health with an interdisciplinary specialization in global health. My background spans from clinical work to global engagement. And I also have research experience from avian influenza, One Health research ethics, foodborne illness, and other infectious disease. I did a slight shift for my career, and I am currently the Senior Program Manager for Ryan White Part A HIV/AIDS services at the Boston Public Health Commission.
Excellent, thank you. And Dr. Ghanem.
Good morning, everyone. Again, thanks for the invitation and happy to be back with GOHi anytime. So my name is Mostafa Ghanem. I got my veterinary degree from Egypt in 2007 and then practiced poultry medicine for 5 years while doing my master's back there. And in 2012, I got my PhD scholarship to attend Ohio State for the first time. And that's where I started my PhD in comparative veterinary medicine and avian mycoplasma laboratory, doing molecular sequence typing assays for avian mycoplasma species. That's before I finishing my PhD, or right at the time of finishing my PhD, I came to know Ohio State Global One Health Initiative and Dr. Gabriel in the same department. And after that, I got a postdoctoral training with the Global One Health Initiative, mainly the infectious disease molecular epidemiology laboratory, where I served as a research coordinator for the One Health East Africa training program, and I'm working with many fellows on many different projects, ranging from Campylobacter genomic enteric dysfunction to MRSA nosocomial infection, and other many projects at the time at GOHi. And in 2019, I joined the University of Maryland and became an assistant professor of molecular epidemiology, doing some extension teaching and research work with the vision of One Health, and we'll talk about that later.
Excellent, great to have you. And last but not least, we have Dr. Nguta.
Thank you. Good morning and good afternoon for those of us from this part of the world. Now, my name's Dr. Joseph Mwanzia Nguta, having attended KV Primary School, Utala High School, and the University of Nairobi, where I did obtain Bachelor of Veterinary Medicine degree, Master of Science in Pharmacology and Toxicology, and a PhD in Pharmacology and Toxicology, special emphasis in natural product pharmacology and toxicology, specifically from medicinal plants. My fellowship work at Nguta Memorial Institute for Medical Research at the College of Health Sciences at the University of Ghana led to the isolation and identification of solagenin, a compound from a locally used medicinal plant in Ghana known as Solanum tovum, mainly the fruits. And this compound did exhibit exciting antimicrobacterial activity. My later work, in collaboration with Tres Candos Laboratories of Smith Klein Beecham in Spain, and again in close collaboration with the Institute for Tuberculosis Research at the University of Illinois, United States, led to the identification of solagenin analogs with good activity against zoonotic Mycobacterium bovis. Currently, I am a senior lecturer at the Department of Public Health, Pharmacology and Toxicology, Faculty of Veterinary Medicine in the University of Nairobi.
Excellent, thank you all. And it sounds like we have a wonderful diversity of panelists, both in your training and experiences with GOHi, and then now in your current duties. So we're looking forward to hearing more about that and your path to where you are today. So thank you all again for joining us. For our next question, we're going to go back in time a little bit. So I would love for you to discuss more about the work that you did with GOHi, either as a graduate student, professional student, a fellow. We would love to hear more about your experience in the training that you received in collaboration with GOHi. Dr. Oruganti, would you want to go ahead and start us off first?
Sure. So I started with my global health involvement when I was a master's student in the public health program. So I was part of a interdisciplinary project in Nicaragua that was looking at children's microbiomes, and my aspect of that was more looking at the human-animal interactions and how that could possibly influence children's microbiomes. And then when I was a veterinary student, I participated in the summer research program that's available at Ohio State for vet students. And through that, I received the Global One Health Fellowship for vet students and was able to travel with Dr. Berrien to South Africa in 2019. And this project specifically focused more on better understanding how gender and zoonotic pathogen exposure are related. And so that was also utilizing the more social science methods and ethnographic methods, including focus group discussions and household observations within a rural community in South Africa, just to better understand how just daily life and gender roles can influence our interactions with the environment, and how that interaction could potentially influence people's zoonotic disease exposure in that community, and really just taking a look at how the interactions that people have with livestock, the environment, kind of that whole One Health picture, how we can take that into consideration. So that was my most recent involvement with GOHi.
Excellent. And I'm biased, but it does, obviously hit the high notes of all the One Health interrelated connections between animal health, human health, environmental health with that project, and using different methods. That sounds super relevant and interesting. And hopefully we'll hear some other diverse projects that other panelists have been involved in, such as Ms. Lopez. You mentioned some One Health ethics work and some other very interesting One Health work that you've been involved with GOHi. Would you like to elaborate on that?
Yes, absolutely. So during my time at OSU for my grad program, I worked on 2 projects with GOHi. The first one that I was with an internship with Dr. Kowalczyk with the Center of Foodborne Illness Research and Prevention. That was for my practicum. It was a project called TARTAR, which is the assessment and management of risk from non-typhoidal salmonella, diarrhegenic E. coli, and Campylobacter in raw beef and dairy in Ethiopia. This project that I worked on was a subset, which was a retrospective analysis of clinical laboratory results for stew samples in Ethiopia. This project really worked closely with the Ethiopian Public Health Institute and International Livestock Research Institute. With this role, I was able to complete an IRB, a preliminary data capture system, which is something I've never done before, and I didn't know where even to start. And that system was used by a number of hospitals to test their foodborne illness reporting. And overall, that project encompassed SOPs and understanding the importance of disease reporting and the modes of exposure in that area. And then the other project that I worked on was for my culminating project with Dr. Omathuna and Dr. Aruda, which was called OHARP, One Health Ethics and Regulatory Procedures. I know both mouthfuls of project names. Housed under OHART, which is the One Health Eastern Africa Research Training Program. In that project, I also completed the IRB, conducted a literature review, and created a survey that was distributed amongst researchers, ethics committee members, and regulatory body members within several low and middle income countries in Africa to gauge the understanding of research ethics, policy resources, and ethical challenges to reviewing and conducting One Health research in this area.
Fantastic. You were able to squeeze in a lot of different projects and diversity of projects within your master's degree. So good on you for really getting the most out of your training while you're at OSU. And of course, every good project has to have a good acronym. So that's a check mark on those. Dr. Ghanem, would you like to elaborate on your work with GOHi?
Yeah. So again, I was in the Department of Veterinary Preventive Medicine for a long time, and I've been hearing about GOHi a lot. But once I joined it officially, that was in 2017, late 2017, and I joined it with 2 roles. The first role is Associate Director of the Infectious Disease Molecular Epidemiology Laboratory, where I employed my molecular epidemiology skills and tools into different projects in supporting fellows that came from the OHART project, the One Health Eastern Africa Research Training. So at that role, my role was to provide laboratory support and experience exchange and experiential learning and training for different fellows working on different projects during their training at Ohio State. So there are, besides the work as a research coordinator for OHART in general for allocation and selection of the trainees, Also, I supported the research, and one of the projects that mostly involved in it was the Campylobacter genomic enteric dysfunction. And that project was in collaboration with the University of Florida and Dr. Gabrias and Yitagel Tarifi from University of Gondar. And it was mostly about identifying so it's a big project with different aspects, human and animals, and environmental sampling of environmental sampling for chicken dropping and sampling of chicken and cattle, and sampling of children to identify the Campylobacter species diversity in Eastern Ethiopia as one of the lead factors for diarrhea and stunting in children under 5 in Ethiopia. So during that project, we used the metagenomic sequencing approach to classify and identify different diversity of Campylobacter species. And we found new species that are not previously categorized as most prevalent in human. There are 2 major species in human, Campylobacter jejuni and GOHi, and however, we found the most prevalent species of Campylobacter is completely different from these 2 strains. And that's one of the key finding in the molecular epidemiology portion of the project. On the human portion of the project, that was the duty was the University of Florida, and they were more involved with the assessment of the children health and with these profiles of different Campylobacter. We had published 2 papers together on this project. In addition, currently we are working on publishing another paper from another fellow who was working on the prevalence and distribution of Mycobacterium tuberculosis in Ethiopia, in Eastern Ethiopia regions as well. He had a lot of samples. We did whole genome sequencing for these samples, and I helped him with the analysis of these and applying core genome MLST for his Campylobacter to characterize the Mycobacterium genomes to characterize these species diversity and identify the most prevalent genotypes of Mycobacterium and different risk factors associated to these. We had several other fellows working on antimicrobial resistance. I did in sewage and working on MRSA, nosocomial infections. All of them had samples from Ethiopia, originating from Ethiopia, and we had to help with the genotyping characterization in our lab and as a part of their career. In addition to that role, I participated in the One Health Summer Institute training on molecular epidemiology, as well as teaching the course at veterinary preventive medicine as well. So that's mainly in addition to other extracurricular activities. So working in GOHi is one team work, and everybody fill in whenever there is a need and gap, and you not necessarily adhere to your job description. So it was a very enriching experience overall for me in different aspects, teaching, doing research, and communication during that time.
Fantastic. So much to elaborate on, and it really show the diversity of work that you can get involved in. And as a PhD student, obviously a lot of great interactions there between animal and human health that you're mentioning, environmental and microbial stewardship. You mentioned so many wonderful things, and you got to do it all because of the time that you spent with GOHi, including even some teaching. So obviously that prepared you well for where you are in your current position. I'm looking forward to hearing more about what you're doing in your current role and how this has all shaped and prepared you for your role now as assistant professor. So thank you so much. And then Dr. Nguta, would you mind talking a little bit about your experience and your work with GOHi?
Yeah, thank you, Amanda. Yeah, I joined Global One Health Initiative family in 2011. And the same year I did present my research findings from my doctoral studies at the first International Congress on Pathogens at the Human-Animal Interface. That was the first ICOPI meeting, which was held in Addis Ababa. I have also presented my research findings at the second GOHi meeting, which was held at the beautiful city of Porto de Galinhas in Brazil in 2013, and also at the fourth GOHi meeting, which was held in Qatar in Doha in 2017. Currently, I am a Global One Health Initiative Fellow under One Health Ethics and Regulatory Procedures Project, and I'm also a co-investigator in a National Institute of Health Fungat International Center R25 funded project under the Global One Health Initiative. I will talk about my roles in these two projects later.
Fantastic. Thank you so much. And I think so that the next question we had was about your current roles and as particularly how the work with GOHi enabled you to do the work that you're currently doing. So maybe we'll start with you, Dr. Nguta. You want to continue in describing that connection?
Yeah, thank you, Amanda. Now, as a senior lecturer at the Department of Public Health, Pharmacology and Toxicology, the Faculty of Veterinary Medicine here at the University of Nairobi, I am involved in undergraduate and postgraduate teaching, conduct of research consultancies, and community outreach. As a GOHi fellow, I am involved in exploration of ethics review challenges which are encountered by One Health researchers, research ethics committees, and regulatory members in Africa. During my course of work in this project, we have identified a number of challenges, key among them being required need for training as a key challenge that continue to hinder timely and appropriate ethics review of One Health research in Africa. As a co-investigator at the Global One Health Initiative NIH-funded project, I, together with the whole team, we're aiming at building capacity in One Health and emergency research ethics in Kenya, and by extension, in the East African region.
Fantastic, thank you. And I'm hearing some common things here with the One Health research ethics, and that being maybe an interesting area we can elaborate on more as well with Ms. Lopez's experience. So looking forward to diving a bit more into some of those challenges and paths forward based off of the work that you've done. Dr. Ghanem, did you want to talk a little bit more about your current role and those connections between your experience with GOHi?
So in my current role, I have a three-way appointment. So I mainly research and extension and do as well teaching, so graduate teaching. So for the teaching is I do graduate education, graduate course called Molecular Epidemiology of Infectious Disease, which is a replica of the course that's done at Ohio State. Here, that our program didn't have that component, so I added that component with the One Health spin on it. In addition, I'm coordinating another similar course for the department that used to be held for a long time, but it wasn't called One Health. So our department does a lot of zoonotic disease, epidemiology, infectious disease, and immunology. But they didn't call that webinar or seminar as One Health. So we renamed the course into One Health Seminar, and that's one of the impressions that I came from Ohio State to call that course as One Health Seminar, and that's another webinar. That's for teaching. For the research, again, building on what I learned at Ohio State, so I established the molecular epidemiology laboratory. And as well, so the goal or the focus of my laboratory is to develop new sequence typing assays for different pathogens. But in the past, I was mainly focused on avian pathogens. However, right now, I am focused on also some zoonotic pathogens that affect poultry, like Salmonella, mostly Salmonella, Campylobacter, and other antimicrobial resistance avian pathogens that contribute to the general repertoire of antimicrobial resistance. However, it's not one of the indicator pathogens because it's a strict poultry pathogen. So this seems is applying again the skills of molecular epidemiology into solving problems that's not only related to poultry, it's also poultry and the human problem like antimicrobial resistance and foodborne pathogens. The third role that I am participating in is extension. So for those who doesn't know what extension means, it's bringing knowledge into the general community outside the walls of the university. So with my experience as a poultry veterinarian, I mainly develop poultry health extension program, providing information to poultry industry veterinarians and growers in Maryland, poultry growers in Maryland about the health and disease problems that they may encounter and providing solutions for that. So whenever they have a new pathogen or a new outbreak, I help. For example, my master's student is working on developing multi-locus sequence typing for an avian pathogen that doesn't have any typing scheme right now. So that's how I can provide, using research to provide solutions for the community, and that's basically my extension program. And lastly, I am a faculty member with the Center for Public and Corporate Veterinary Medicine, which is a center of excellence, unique of its kind. It's the only center that's present in all veterinary colleges. And this center focuses on training veterinarians on becoming a public or a corporate veterinarian. So veterinarians practicing anything other than a private clinical practice. This center has the capability of career transition, so helping them in making career transitions after graduation. Also, it's helping training veterinary students who have a public corporate track within the college to get experiential learning opportunities in different federal, state agencies and corporates like allied industries, pharmaceutical companies, and poultry industry. So my role is that I am just located in the Maryland campus outside in Washington, D.C. And just at the borders of our campus, the FDA, Center for Food Safety and Applied Nutrition, FDA, Center for Veterinary Medicine, and the USDA ARS, Agricultural Research Services. So, and NIH, of course, it's 8 miles away. So with all these agencies around us, I'm entrusted with facilitating experiential learning opportunities for veterinary students to acquire these experiential learning opportunities in different areas. During their training, they are required to do clerkships and externships, and I facilitate these as well for our students. And there is a goal to make that a national center of excellence where we can do that same kind of training for different students from different veterinary colleges as well. Sorry for that, but it's diverse. It's a lot.
Yes, you sound like a very busy faculty member, and very interesting to hear some of those unique programs available at Virginia, Maryland that are one of a kind. That's really interesting to hear about these different ways that people are training veterinarians, future veterinarians. So thank you for that. Ms. Lopez, would you like to tell us more about your role with the Boston Public Health Commission?
Yeah, absolutely. So as previously mentioned, I'm the Senior Program Manager for Ryan White Part A HIV/AIDS, which essentially means I manage the funding environment, policies, and services that are able to provide core and support services, for example, medical case management or mental health services for people living with HIV/AIDS in the Boston EMA. EMA stands for Eligible Metropolitan Area, which is 10 counties in Massachusetts and New Hampshire, spread out 7 and 3 respectively. So my main role, I incorporate my One Health skill set almost daily, from disease reporting to health policy, research ethics, and education. I have the opportunities to work with internal and external partners on various aspects of public health. The reason we're able to do so is because Boston is a very large major city, and it's also a port city and a city that accepts refugee populations. And it is important to be mindful and also have that collaborations and to have that same approach to infectious disease in such a major city. Me being in city government, I actively work with the State Department of Public Health, global health organizations in Boston like the Harvard Global Health Institute, Partners in Health, Botswana, Harvard AIDS Partnership, and with the local hospitals as well. That collaboration is really critical for my role to understand what the HIV prevention and policies are in their networks, and how to best align them with our own. And then also to collaborate and, you know, be understanding of our successes and progress in this field together. My interest in HIV/AIDS services is with our refugee and immigrant populations. We see a large population from Democratic Republic of Congo, Burma, and Syria, as well as those who are experiencing homelessness from all over the country. I'm able to work with the state policymakers and the Boston Environmental Protection Agency, Water and Sewer Commission to work with these populations to achieve health outcomes. I also work with comorbidities with HIV, such as foodborne illness, like my practicum, tuberculosis, hepatitis, and diabetes. And with that includes reporting, public health messaging, and health policy. For HIV/AIDS projects with our external partners, I've collaborated on testing wastewater for different pathogens, and also testing how those pathogens are being inputted into our sewer system. So working with the EPA on that. And then also working with our refugee population, where I incorporate the research ethics findings and review skill sets to help the group create the infrastructure to best conduct these projects and how to rehouse and affirm these groups. And aside from HIV/AIDS services, I have worked on a couple of One Health campaigns for the city. A big one, which we all have, has been COVID since 2020. And I was also brought on as a veterinary public health consultant for the monkeypox outbreak that we have experienced this past summer and are ongoing. And we did have 2 or 3 cases of West Nile virus this past summer as well. We regularly hold town halls with the Education Department, Zoological Society, environmental agencies, Department of Ag to collaborate on best practices and pathways of moving and improving the health outcomes, which is, the goal. And overall, the last thing that I will say about how I incorporate my One Health skill set is electively, on top of the workloads that we all have, I joined the advocacy and extension group, where I contribute lessons and trainings on the collaborations, my research, and how it relates to the group's roles, but also our working with internal and external partners.
Fantastic. You found a lot of ways that you're incorporating One Health. And it's interesting when you first hear about a public health commission and your primary focus being on HIV/AIDS, which is a human-centric disease, right? We often think about One Health in the context of zoonoses only, but here we are. You found all these different ways that One Health skill set has been directly transferable to the work that you're doing, even when it involves working with just humans or a human-centric disease. So really fantastic for you to hear about all the work that you're doing and exciting ways that you're integrating One Health and becoming really the expert, it sounds like, in finding ways to use your skill set and your training at your current workplace. So thank you for that. And then Dr. Oruganti, would you like to tee us up for the next one, which is about your current role and how your One Health skill set has been used at the USDA?
Sure. So since I'm a government veterinarian, we kind of have capacities that are similar to government veterinarians across the world. So a lot of that is enforcing the animal health regulations that we have in place, both nationally as well as our own, local state regulations. And all of it really focuses mostly on our food animal species and food producing species. So we really do things like we're out there doing bovine TB testing. We're, monitoring animal disease traceability and making sure producers are, tagging animals and identifying animals correctly. We do inspections of markets and other lab facilities and that sort of thing. One of the biggest things we've been focusing on recently this year has been the high pathogenic avian influenza outbreak, which has hit our state pretty hard as well as other states in the US and of course across the world. And so that's been a major focus, is not only responding to those outbreaks, but also, educating the community and even backyard poultry owners about how to prevent avian influenza in their flocks. And so a lot of the work is, more that applied field epidemiology and really just communicating and educating our stakeholders. And we work a lot with the local levels. So we're USDA, so we're federal, but we're working a lot with our state partners to accomplish our responsibility of preventing animal disease. And there's other, program diseases that we specifically focus on as well, such as scrapie, chronic wasting disease, those kind of things. And all of this really stems from wanting to prevent foreign animal disease and other major animal diseases in our animal herds. And we're working at a local level, and this is kind of where that One Health aspect comes into play, is that I'm working in the local level here in my state. But really, when you look at it, our charge as government veterinarians, we want to work with our local partners, and across the country to prevent diseases from entering our country, but also with our international partners. So a lot of what we do stems from, meeting the OIE or the WO standards and facilitating international trade. There's, large international implications if we have a foreign animal disease, or, we also have interest in, animal diseases becoming endemic in other countries as well. And so there is this international piece of, we have to prevent it here locally so that we can have a better picture internationally. And I think with my work in GOHi, I was able to kind of look beyond just, the clinical aspect of veterinary medicine and public health and look at more of like the social, economic, political implications. I mean, now working in government, I really see how policy also influences animal health and how much, when we have the One Health perspective, that's really necessary if we want to make, policies and regulations that are going to be effective and going to help protect both human and animal health. And so though I'm working more on the animal health side of things right now, I can still really see the direct impact to our communities, both locally and internationally, from that perspective of, protecting agriculture as well.
Great, really interesting. I think a follow-up question I wanted to have, and just maybe open it up to all the panelists. And Dr. Ghanem, you kind of mentioned this when you were talking about your current position and how you kind of helped with the renaming of the seminar, the One Health, and bringing more of the One Health into the work that you're doing. Is it just opening up for all of you? What has been the I guess, how has the One Health approach been used or not used in your current positions? How did you influence the use of One Health approaches in your current roles, or were those already firmly established? And I'm just curious how you've been maybe a change maker for One Health implementation in your current roles, and just opening it up for anybody that maybe has had an experience with that. Or Dr. Ghanem, if you wanted to elaborate on that in your experience.
Yeah, so when I joined our department is a joint department between the Virginia Maryland College of Veterinary Medicine and the College of Agriculture and Natural Resources at the University of Maryland. So when I arrived at the university here, at the college, they have a strategic initiative. One of them is called Improve Animal Health, Human Health, and Improve Human, Animal, and Environmental Health. That's one of the 5 major strategic initiatives for the college. So I said, why you don't call that One Health? So it's really, I joined, of course, there is each of these strategic initiatives, there is a committee. So I joined this committee, and all of the people on that committee doing pretty much what we have been doing at Ohio State and trying to do that. But there is not the umbrella of One Health wasn't there. So finally, we tried to change that, and now they call it One Health, improve animal, human, and environmental health. So that's one of the things. In addition, it's an initiative. It doesn't have a formal structure, no organization like Ohio State. So what I'm trying here is I'm using Ohio State Global One Health Initiative as the model for our strategic initiative One Health. So I'm trying to propose the idea, and they already proposed that idea of making a vision and mission based off Ohio State Global One Health Initiative, where we trying to set some goals and for the teaching and research in One Health, so One Health teaching, One Health research, what we're gonna do in research, what we're gonna do in extension as well. And how that it's already part of One Health, because it's a very College of Agricultural and Natural Resources is really doing a lot of One Health work, but it's not acknowledged that way. And what we're trying to do is to categorize that, to recognize it as a One Health work and One Health initiative. That's this vision. Of course, if I hadn't been in GOHi or Ohio State, I didn't have or know how to do that. And as a matter of fact, I cite that I came from Ohio State, and I'm trying to do what Ohio State has been doing, and the response has been amazing. And I always visit the website at Ohio State GOHi and learn from it about the strategic plan, strategic initiative, which I participated in the discussions and the great brainstorming and the great conversations that has been doing during my time. And I always happy to use Ohio State GOHi as a model to build that model here at the university.
Fantastic. Great to hear. And great to hear that you continue to.
That's where we are right now. I'm talking about the college level, but definitely in the future, we have the plan of going beyond that, because we have FDA, USDA, and NIH just outside the doors. But we're trying to create the vision first that Ohio State has and have been doing from maybe how many miles away with these entities. So they are just next door. So hopefully in the future, we try to create that consortium, One Health consortium, with these public agencies as well that close by. So that's the future vision, and it's all building on the model that has been built at Ohio State, which is GOHi.
Fantastic. Thank you for that. And a great testament to how it's so important that we develop these trainees, these change makers, and then you all go out into the world and implement what you've learned in your various agencies, and the diversity of agencies that you work in. It's really critical to establishing One Health initiatives and approaches elsewhere. So fantastic to hear that you've continued to do that. Any other panelists have had experiences with maybe a One Health change maker in your current roles?
I can speak on that. So at the Boston Public Health Commission, it's definitely not the standard going in. And coming into this role, I have made it every effort to make it the standard and incorporate it at some level in any project that I'm working on. And it is kind of, a little bit jarring to come from an environment that is One Health focused to not. And I think also the people who are here want to learn, want to collaborate, want to understand the importance and the approach. And so that is half of the, work, to have an audience that is willing and able. And then also in my, experience in my education, I think I'm one of 3 who have some sort of animal or veterinary background in the human health services department here. So we work in conjunction together to how best to do trainings or education materials on One Health, and we are enjoying that advocacy portion of that.
Great. Thank you so much for sharing. Any other comments on this topic before we move to the next question, Dr. Nguta?
Yeah, thank you. Here at the University of Nairobi, we recently reviewed our curriculum for our veterinary students, and we are now teaching our students One Health. We also have an association of One Health for our students. And again, in our research, we are also embedding the concept of One Health in our day-to-day research activities. Our faculty, the Faculty of Vet Medicine, is also a member of the African Network for the One Health, that is AfroOne. Now, we are also taking the One Health to another level, where we are now developing a postgraduate curriculum and a master's curriculum where we'll be training the next generation of scientists in One Health ethics and also in emergency research. So that's what we are doing here at the faculty. Thank you, Amanda.
Thank you. Any other comments? We'll move on to the next question. If not, Dr. Oruganti, did you have something?
Sure.
Okay.
I don't think I've been a change maker, but I think I've made an observation of going from a kind of more university setting to the public setting, in that it's so there's kind of like the One Health application in research and teaching, and then there's the challenge of One Health application with kind of the programs and the like in the field aspect. And I think that's something I want to continue to explore, is how do we take One Health into the kind of the real world setting and some of the more hands-on things in actually working with the community partners. I think that's been a challenge in kind of seeing what we do in the government work, is how do you communicate One Health to those who are, not familiar with that term, or they don't really understand, okay, what is a research concept, or, that kind of thing. So more of that One Health communication aspect, I think that's a really exciting challenge. And I think we all agree that that's something that we kind of have to continue working on, is how do we communicate One Health to those audiences outside of kind of the university environment and those within our own professions. So that's just something I kind of want to continue exploring too, is that aspect of One Health and taking it outside of our kind of like what Melanie was saying, people who are exposed to it already and kind of get it in a fundamental way. How do you take that outside of that?
I think COVID make your job much easier, Dr. Oruganti, right? So you have COVID in human and COVID in some white-tailed deer, right? It was in Iowa and and Ohio as well. So it's the same COVID that affect the human is then now in animals. High-pass avian influenza, I think the one suspicious human case that came with high-pass avian influenza was in Colorado, right? So there are many examples that help you in your outreach and education efforts.
Yeah, great observations, and really interesting to hear your different perspectives. But you've had now the academic perspective and the kind of the research. Now we have the public service and those who are more engaged with the community. So great to hear those observations that you're making, and it helps us too on the side of preparing next generation One Health practitioners and how the skills that they need to know and learn to be effective in the various roles that they have. So thank you for sharing those observations. My next question is for each of you is, what advice do you have? So now that you've been through your training or fellowships, you are in your current roles, thriving in your One Health practitioners, what advice would you have for people who are in your shoes where you were a few years ago in trying to pursue a career in One Health and getting unique experiences that you all had the benefit of through GOHi? Advice that you have for those individuals now and how they could be successful. Maybe we'll mix it up. How about Ms. Lopez? We'll start with you.
Yeah, sure. So, knowing the ideals of One Health and its interdisciplinary approach and its global reach, my advice is to do that and think globally. If there isn't opportunities in your immediate vision, use your contacts to network and reach other areas of public health that you potentially did not know you were interested in. For example, I expanded from veterinary approach to foodborne illness and research ethics, and in doing so you become more well-rounded and you expand your skill set and your knowledge, and you will become more familiar with the landscape and infrastructure of One Health practice, and then once your foot is in the door, you will see that there are multiple avenues to reach your goals and ways that you can accomplish the One Health mindset and approach.
Great, that's helpful. Thank you. Dr. Nguta, advice for the next generation.
Yeah, thank you, Amanda. Now, my work with the Global One Health Initiative first has prepared me to approach my teaching research and local, regional, and global collaborations from a One Health perspective. Again, appreciating the interconnectedness between human, animal, and the environmental health. In addition, it has prepared me and equipped me with the skills to look at One Health as an ethical project. And at this time, the need to value humans, animals, and the environment equally and equitably at the time of detection, prevention, response, and recovery from global health emergencies. A need for us to ask a number of questions. What is it that is valuable to us? What do we need to dispense? What do we need to protect during our response to global health emergencies? Moreover, Global One Health Initiative has prepared me to carry out my ethics review duties as a member of my faculty research ethics committee. I'll advise to my fellow scientists would be that they need to join and get involved in the activities of our local, regional, and global One Health outfits. For example, the Global One Health Initiative. Now, they need to practice One Health approach in their scientific roles. They need to use findings from One Health research to inform the policy formulation and the practice of One Health. They need to embrace multidisciplinarity because One Health cannot be conducted by one specialty. They need to cross the research boundaries. They need to get involved in local, regional, and global multidisciplinary research teams. They need to identify and work closely with their mentors who at the end of the day will help them in building their careers in One Health research and again in One Health ethics.
Well said. I like that. Dr. Ghanem, advice.
So first of all, they have to recognize their goals. So if what they really need and what they are looking for, and identify their needs and their goals clearly before moving forward. And if One Health is one of their goals, I think there are many people around that does a lot of One Health work, but they don't call it as One Health work. So go and find what you need to learn, and if it's labeled as One Health or not, that's your belief, that's your choice. You want to do that thing, and if it's called One Health or not, go for it, because none of the panelists here had a One Health certificate, One Health program. But the interesting thing that I Googled One Health certificate, which I know that was one of the goals at the time. I was glad to come to have that. I have 7 or 8 programs called One Health certificate, and each one of them has a different flavor. So at Ohio State, it's global One Health. It's not just One Health certificate. It has infectious disease zoonosis flavor. I looked at other universities, they have a different flavors or different courses and perspective of it. So everything is called One Health, but you have to know exactly what kind of training and look closely for what you are selecting, and then make an educated choice. Try to get in touch with trainees and previous trainees or graduates of these programs and get an official training in One Health, or because that's was until recent. I don't think that 2 years, 3 years ago, these programs were there called as One Health. They may be there before, but they were not labeled as One Health. So that's advice. Know what you need to know to do and what your passion is about, and then do the research and identify what exactly will get you to your goal, and make an educated choice of your education and your training. And it's not necessarily called One Health again. That's a trick, is because a lot of people doing it a lot of ways and get a wonderful training, but it's just not called One Health. But right now, if you want the label, there are many official programs, including the Global One Health program at the School of Public Health at Ohio State.
Yeah, great advice. And I think you're right. The number of formal One Health program certificates and trainings are increasing, but you're right. Every place you go is going to have their unique flavor and specialty under that huge umbrella. So being clear with your goals I think is a really good piece of advice. Thank you for that. And Dr. Oruganti, advice that you would have?
Yeah, I would say first, kind of expanding on the other speakers, just, we don't only need like a certain type of educational background or experience in One Health. That's the whole point, is we want people from all types of backgrounds, all types of education fields to be involved in One Health. And so no matter where you are and what your interests are, I think there's a way that you can contribute. And so being creative about it and really just thinking outside of the box of, what we need for One Health. And I think that's really important. And I think also just the way I was able to get involved with this was, fortunately being at Ohio State already, but I think for all of those on this call, you're already connected with GOHi. And so that's, you're already part of this network, and really utilizing that network and, kind of taking that leap and reaching out to all these amazing professors and students and other, folks who are involved in One Health initiatives already. That's how I got my start as a student. And so that's the advice I give for other students who want to be involved. Is it can be a little bit scary, but you can, if you reach out, most people in One Health are super excited to have students who are really interested and passionate and want to do something new in One Health. And so that's the biggest advice I would give for those who want to continue doing One Health research, even if you're not a student and you're a practitioner and you want to get involved more. I think there's so many opportunities. You kind of just have to reach out to those networks that are available. And I think other than that, my biggest takeaway from my experiences in GOHi has been kind of stepping outside of your comfort zone and your country perspective, and working with international partners is very, very challenging from no matter where you are. And I think that's the biggest thing I learned, is just how do you work outside of people from your own culture and from your own background, both educational and otherwise. And so being able to do that and finding the excitement in that, I think that's really important if you want to be involved in One Health and global health.
Great, well said, and a lot of good nuggets of wisdom in there that you were able to reflect on. I would love for each of you to reflect a little bit on why you think One Health is important in today's world. And I think maybe, what do you think is the next frontier in One Health work? I've heard a couple different things with One Health ethics and One Health communication. And so I guess, why is One Health so important? Do you think it's going to continue to be important? And what do you think will be the next frontier in One Health work? Think about a little bit, the 3-part question there. And then I would love to hear from each of you on that question. maybe, let's see, Dr. Ghanem, I don't think I've started with you yet. Would you have any thoughts on that question?
So this question is, the answer for it is, the more we know about our world, the more we know how it's complicated and interconnected, right? So global change now is affecting everything, every aspect. The climate change is affecting everything and every aspect of our life, right? And it's affecting animals, human, and the environment as well. The world is changing, the health is changing. And this is a complicated problem that requires a multi-disciplinary solution, right? The effect of climate change on human health, animal health, and environmental health, and how production and health of animals and human will be affected with climate change. That's a very complicated problem, right? And it requires a multidisciplinary solution. And this multidisciplinary solution is called One Health Solutions. So basically, that's a single problem that requires a multidisciplinary approach for solution. And that's basically one multidisciplinary solution is called One Health. So we have many examples for these complicated problems that require multidisciplinary action and conversations among scientists and people that has and researchers from different perspectives. And basically One Health does that. It brings everybody on the same table, not necessarily speaking the same language or having the same experience, but they are addressing the same problem from different perspectives. So that's why One Health approach is the next frontier in science, in approach, in vision of our problems. And it's basically complicated problems require sophisticated, smart solutions, multi-similar solutions represented in One Health solutions. That's my answer why One Health is important, because our problems are complicated and require this multidisciplinary approach of working and thinking and solving them.
So in other words, One Health isn't going anywhere, right? These problems aren't going anywhere. So One Health is not going anywhere. Let's see. Let's bounce back to you, Dr. Oruganti, your thoughts on the question of why is One Health important?
Yeah, I think, I mean, we've all had these conversations about COVID and why that, why was COVID able to become such a global problem? And I think it's because of how interconnected we are, both physically with, being able to travel all over the world at a moment's notice. And then also digitally, like on the internet, we're just connected 24/7 across the world. And that's why Global One Health is so important now. I mean, we're just going to continue that interconnection and expand that even more as we go into the future. And that's just a reality of the way that we're physically and digitally connected. And I think also just specifically kind of expanding on what I was talking about before is the challenges we've seen like with COVID, with communication and just science literacy and, being able to educate our communities about science and research and why it's so important. I think that's kind of going to be a really important step going forward with One Health and every aspect of the One Health spectrum is that communication and education aspect and just really involving all of our community members and showing them the importance of One Health. So.
Thank you for that. Dr. Nguta, your thoughts on the question of why is One Health important today and any ideas of what's on the next frontier for One Health?
Yeah, One Health, and not only One Health, but also One Health ethics is quite important in our today's world because the health of humans is dependent on the health of animals and their shared environment. The world has experienced a series of fast-moving novel pathogens, right away from the influenza viruses, H1N1, and Ebola to coronaviruses such as the SARS, MERS, and COVID-19, and monkeypox. Now, One Health and One Health ethics will help us partly to respond to a number of questions. One, what is driving this seeming acceleration of shared infectious disease threats. 2, why have governments and international organizations, such as the World Health Organization, been so unprepared during pandemic times? 3, again, which is more of an ethical question, why have normative instruments, such as the international health regulations and the pandemic influenza preparedness framework, been inadequate? 4, what might harden our national and global capacities to prevent, respond to, and recover from our shared threats? And again, how can nations and the international community, which is again an ethical question, achieve equity and equality in distribution of life-saving interventions at times of outbreaks of shared threats? Now, we should never forget that the shared threats as a frontier now are just around the corner. Of late, we have the recent outbreak of Ebola in Uganda, a moment when we should prepare, anticipate, and get ready to prevent new ones from popping up. Now, in his recently released book, How to Prevent the Next Pandemic, Bill Gates made several suggestions, including proposing a global epidemic response and mobilization, the so-called JAM team, whose priority would be pandemic prevention. Now, the JAM team would be made up of people with a wide range of expertise. And this is adopting a One Health ethics and One Health approach. Thank you.
Thank you. Well said. And then finally, Ms. Lopez, your thoughts on the question of why is One Health important? Is One Health important today, and what is on the next frontier for One Health?
Thank you. So yes, One Health is so important because we have seen, like the others said, significant gaps in our health infrastructure. And all of us here are aware of the statistics on morbidities, likelihood of the next pandemic, and the strain of the health system when working in areas with limited resources. And we need to work on connecting the various different health silos that we see that are clearly evident in our immediate circle, but also internationally, and closing the knowledge gaps by working with the global, regional, and local networks. That part is really key. The education needs to be flowing from up and down. And all levels and all areas of overlap should be working in tandem to achieve optimal health outcomes. We see that what happens when there are areas in the local level next to each other that don't have the same protocols for public health and what effects it has. So the question why One Health is important is the answer, because everyone should have an approach and an understanding that our impacts are larger than our own unit. And it's critical for the time, as everyone said, of the interconnectedness that we live in. The next frontier would be, I think, integration of ethics and One Health into education from an earlier point. The mindset and behaviors should be taught and developed prior to an emergency situation, and standardized, solidified that practice, capacity, and infrastructure into benefit like solutions and preparedness for the future.
Excellent. Thank you so much. Before I want to move to the questions, we have a really wonderful engaged attendees who are writing their questions into the Q&A, so we'll share those in a bit. I also just want to mention, as former students and fellows of GOHi, you make us all so proud. So thank you for taking the time here. You've shared such really great insights and have been giving us all some great food for thought. So thank you for that. Maybe to start, because Ms. Lopez, you mentioned the need for increased integration, and I completely agree with you, and the difficulty of silos. We have a question from Zakaria, and I'll just read it out loud, and all of us can reflect on this, but maybe Ms. Lopez, since you started off with this in your answer, we'll start with you. The question reads, zoonotic diseases will remain of great public importance because of, one, a lack of coordination between physicians, veterinarians, and epidemiologists, unfamiliarity of physicians with these diseases, and inadequate diagnostic facilities. How do we overcome this lack of coordination between the different sectors, different disciplines, and maybe the lack of training of these different disciplines in areas that intersect? Thoughts on that question?
Definitely a large question, a large prompt for sure. But I think it just starts with one person, one group, with the drive and want to connect those silos. I think potentially incorporating more education and advocacy at extension groups for those who have already finished their education to have that mindset of continuous education and quality improvement in their methods and education for One Health, research ethics, etc. I think that could be one aspect. But it is definitely a thinker and it requires input from all aspects of health, not just One Health oriented individuals, but public health, environmental health, and animal health.
Thanks for tackling it. It is definitely a big one. So no easy answer there, but always wanting to hear different people's perspectives and thoughts on this challenge that we continue to face between the lack of coordination. Dr. Ghanem, did you have a comment on this one?
I think it's the time will solve that. So there are many initiatives right now for increasing education, outreach, and engagement in One Health. And for the current situation, I believe it will change in the future. It will not stay like that because every day there are many new physicians and new veterinarians, epidemiologists that graduate with, they know what's One Health and they are more knowledgeable about that. The other thing is we have, I think the policy has to change, or maybe there has to be the continuing education hours for current physicians, maybe require One Health, and that's a policy change, right? So it's require some concepts of, or covering some continuing education credits under the umbrella of One Health, and that's a policy change that needs someone to work on, but that's the only way to address the current gap sooner than the future, of course. So I believe the change will be in the future. For the current one, it requires policy change, requiring one of the things that can change is requiring continuing education credits to be allocated to One Health education as well.
Yeah, really, really great insights. We'll continually hear the problem of an over-crammed curriculum, which we all face in professional programs. And so tackling that through continuing education, I think, is an interesting approach. Thanks for that. Any other thoughts on this particular question?
Yeah, may I chip in, Amanda?
Please.
Yeah, I'm going to look at the question from the three parts. The first part is asking of the lack of coordination between physicians, veterinarians, and epidemiologists. And I'm even going to add, and even the environmentalists. Now we have to work together. We are going to overcome the challenges by working together. Physicians, veterinarians, and environmentalists, and blazing the multidisciplinarity complex in our approach to our One Health problems. Now, the second part of the question, I'm just trying to look at the question.
Unfamiliarity of physicians with diseases of zoonotic origin.
Yeah, unfamiliarity of physicians. That's why the veterinarians comes in. Zoonotic diseases, for example, rabies, anthrax, they will be jumping from animals to humans. The physicians will have to embrace the veterinarians because the veterinarians can easily prevent the outbreak of anthrax from the source by vaccinating all animals, mainly the dogs, which are implicated in the transmission of these illnesses. Now, the third part was, it has a third part.
It was about inadequate diagnostic facilities.
Yeah, and again, this is an ethical question. And I did earlier talk about equity and equality in distribution of social determinants of wealth, especially between low and middle income countries and the high income countries. That is what is going to solve this problem, as we saw with the COVID-19, where some countries had all this infrastructure, diagnostics, vaccines, and Medicare accessible to them when the least developed countries didn't have any of this. So again, it's an ethical question. We need to embrace that equity and equality in the distribution of these social determinants of wealth. That would be my take. Thank you.
I think maybe we have another question. This one specifically for Dr. Nguta. It comes from Benti, who mentions, you mentioned in one of your responses that you're developing a curriculum in One Health, and they want to understand more how creating a curriculum in health advances interdisciplinary and multidisciplinary approaches that are required to address health challenges, and how can we make sure that doesn't create a further disciplinary silo? Would you like to address Benti's question?
Yeah, thank you. This is a great question. And it is not going to create a silo. The main objective of this program will be, at the end of the day, to train the next generation of experts that are going to guide a policy formulation, which is going to, again, guide the practice of One Health globally. And that is going to bring on board environmentalists. It's going to bring on board specialists from humanities. It's going to bring on board physicians and veterinarians to respond to the ethical dilemmas that continue to hinder the response, the detection, the recovery of the spillovers from animals to humans. It is not going to bring a silo, it's going to strengthen the approach towards prevention of zoonotic disease outbreaks, their detection and response.
I would also like to say something in addition to that. Having a curriculum in the approach, from all of our experiences, we have that education, that training, and we are all in each different areas. So we can see how that connectedness is closing and how that gap is closing by having one person move to another area of One Health. So I think that if anything, it would reduce the chance of a silo of education and training.
Yeah. Thank you for that addition. Any other comments from the panelists on that particular question about training in One Health programs?
So, I think it's a good point that he brought, how you are not creating another silo, right? I'm calling it One Health. The way the programs, the One Health programs or One Health training or curriculum is set up as a multidisciplinary program. So I don't see it's another silo, because the vision and the way it's created, it's not a degree in a specific discipline. It's one it's a degree or a curriculum in One Health, and you will see it's multidisciplinary under it. It's not one direction only, it's covering multiple things. That's what I have seen from the few programs that they have been looking at in the curriculums that cover One Health. So The way it is created, that's a guarantee. There is nothing guarantee, but the way it's created, it has the multidisciplinary approach in creating it and in the content of it. And that's basically a simple answer. It will not be another silo because it has that, it's established and created like that.
Great, thank you. We have a question here from Finnan about, is there a procedure for someone to follow or get more information about GOHi and potentially get involved with some of the training opportunities that GOHi provides? Any of you like to comment on that? And maybe I'll tee up Dr. Ghanem because you mentioned some involvement with One Health Summer Institute. If you'd like to share a little bit more about different ways that people could get involved, maybe who aren't affiliated with Ohio State University.
So I think the One Health Summer Research Institute is a great start for anybody who wants to come closer to the network, and it's a great opportunity for networking and knowing the people. Also, you can start emailing people individually with close interest to your interests so that you can get more information. And once you are in the network and the background, they can educate you more about how you can further your step toward getting an official training in One Health.
Fantastic, thank you. Any other panelists have thoughts about other ways to get involved with some of the activities that GOHi is involved in? Anything that you did while you were here or would suggest for others?
Yeah, thank you, Amanda. In addition, GOHi, a family do have monthly webinars like this one. And it's another exciting opportunity to join in the activities of GOHi by becoming a member and participating in the monthly webinars where you are going to be introduced to a wide range of experts who have a lot of interest in One Health research.
Fantastic, great point. Yep, you can learn more about GOHi and the work that we do and the scientists that we train through the monthly webinars. Additionally, we have their newsletters that go out. So check out the website to follow more about the GOHi activities. I do see a comment here from Dr. Omathuna about, it looks like it's in regards to the conversation about the silo effect. And Joseph, can you discuss how the MOHIR team has faculty from different disciplines and will include courses on many different types of content?
Thank you. Thank you. Donna, just looking at the question, you could discuss how the MOHIR as faculty. Yeah, thank you, Donna, for this comment. And in my response to that earlier question, I've said the MOHIR team is the program masters in One Health and the Manchester Research Ethics is a multidisciplinary team, a team comprised of specialists from health sciences, from education, from veterinary sciences, from nursing sciences, bioethicists, disaster ethicists, philosophers, and all these people are coming together to address the ethics that are associated with One Health research and emergency research. So by coming together, we are really running away from the silo. We are bringing diverse expertise, diverse disciplines together to solve a central problem, which is the ethical issues that arise at times of detection, prevention, and response to global health emergencies. So it's more of emphasizing on why this program which is aimed at developing the postgraduate diploma and master's curriculum in One Health ethics and emergency research, is not really approaching One Health from a silo perspective. Rather, it is bringing the multidisciplinarity. Local scientists and international scientists are coming together to solve the central problem of the ethical issues that continue to hinder the timely and appropriate conduct of One Health and emergency research. Amanda.
Great. Thank you so much for elaborating on that. Sounds like a very interesting program, very relevant program. I respect for the panelists' time. I know we're approaching our 10 o'clock hour where we're expected to wrap up. So I want to maybe conclude there. I know we maybe have more questions, but please continue to reach out to us via our website, our social media platforms. We're on LinkedIn, as well as on Twitter and other social media platforms. So you can continue to stay engaged with what GOHi is doing that way. But I do want to say again, a very big thank you to each of our panelists for taking the time today to share your experiences, your insights. I want to thank our attendees for being so engaged and for your excellent questions. And Dr. Binkley, did you have some final words to wrap up today's webinar?
No, I just want to second all of that. Thank you so much to our wonderful panelists, our wonderful moderator, and of course, our wonderful audience with all these wonderful questions and discussions. We definitely look forward to continuing to work with all of you, our panelists, to move One Health in practice forward. And then we will then look forward to seeing all of you on November 17th for our next GOHi webinar. And we'll be posting information for that webinar on our website shortly. So thank you so much to everyone, and have a wonderful rest of your day.
Thank you.
Bye.
Bye-bye.
Thank you so much.
Bye.
Bye.